Welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we tackle the topic of the day fast and get you the take-home points you need so you understand the issue and are ready to either fix it or ask the right questions at your next dermatology appointment. Let's get started. Hello, I'm Dr. Rebecca Baxt, board certified dermatologist, and today we are going to talk about dry skin and how to fix it. Dry skin is otherwise known as xerosis in dermatology, and it is apparent by the dry flakes that come off when the skin gets too dry. It typically affects the arms and legs, but it can be anywhere on the body. It's typically worse in the winter, but it can occur in any season. And the trouble is, when the skin gets so dry, it can start to break down and crack, and then it becomes itchy and uncomfortable, sometimes even painful. And when the skin starts to crack, you can actually get an increased risk of infections, either bacterial, fungal, viral, that get in underneath the skin and cause trouble. So we like to prevent the skin from getting so dry that it gets to the point where it cracks and gets infections. Dry skin is typically worse in the winter with the dry air and the dry artificial heat that happen in homes, but again, it can happen in any season. The easiest way to fix dry skin is by moisturizing it. Moisturizers come in 3 general varieties. Lotions are the easiest to use. They typically come in pumper bottles from the drugstore or the supermarket. There's many different brands, and you can pump it out and rub it on your skin, best right after a shower or a bath. If that fixes the problem, then great, you're done. However, sometimes you put on a lotion and it either stings or burns, or it doesn't fix the problem because it's not strong enough, in which case we would bump it up to the next level of moisturizer, which is a cream. Creams have a higher oil to water ratio and are thicker. They typically are purchased in a tube or a tub, again at any supermarket or drugstore or online, and you would rub it onto your skin. They're a little bit thicker, harder to apply, but they work better than a lotion. And if that solves your problem, then again, you're done. However, sometimes when you put the cream on, it either isn't enough or that can burn or irritate. And if you're getting burning or irritation or ineffectiveness from either a lotion or a cream, then you need to bump it up to an ointment. Ointments are greasy, such as Vaseline petroleum jelly, Aquaphor healing ointment, Vaniplay ointment. They typically come in a tub, sometimes in a tube that you have to squeeze out. They are much harder to apply, but they can be very soothing if your skin is extremely dry. So if you're dry and cracking, you might want to just start with an ointment, and then once the skin heals, it may be able to go back down to a cream or a lotion. But those are really the 3 levels of moisturizer that tend to work well. The easiest way to fix dry skin is by moisturizing it. So if moisturizing the dry skin solves the problem, then we're all set. However, this is sometimes not enough for many people, and that is because people have habits that make their dry skin worse, and I'd like to talk about a few of them. The first is either taking a bath or a shower. Soaking in a tub of soapy water does not help dry skin. In fact, it makes it worse. And taking long hot showers and scrubbing with soap also makes the dry skin worse. So I recommend showers over baths and shorter showers and not scalding hot, and certainly not scrubbing with soap unless you're actually dirty from mud or something that you need to get off. Scrubbing with soap is not going to help the situation, and it is also not necessary for your skin to be healthy to scrub it with soap. Sometimes patients ask what natural product they can use to moisturize their skin. My favorite natural product for dry skin would be coconut oil, but there are many others, and any of them will also work fine if you don't want to buy a cream or lotion or ointment. So to review, dry skin, otherwise known as xerosis, is more common in the winter and is apparent by dry, flaky pieces of skin that are coming off, and when it gets severe, it can start to crack and itch and bleed and burn. So we like to treat it to keep the skin healthy. The best way to treat it is to reduce scrubbing, reduce hot water exposure to those areas, and increase moisturizer. There are 3 main types of moisturizer. The weakest are lotions that come in pumper bottles. Stronger than that are creams, which tend to come mostly in tubs or tubes. Then even stronger than that are ointments, which tend to be a bit greasy. Natural products are also fine, and it's best to keep your skin healthy by keeping it nicely moisturized. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative about the skin that you're in and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking to you again in the next episode.